Good morning and welcome. Happy New Year. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist, a certified sexologist in full-time private practice. And this is KMET 1490 AM ABC News Radio. And I'm offering this program along with my colleague, business partner, and friend, Dr. Robert Jaffe. Welcome.
Thank you very much, and happy to be here. Today we're going to be talking more about codependency and addiction and the true self and the false self. When you say in your introduction that we're helping people to become their loving self, that's what we're doing.
Exactly.
And our loving self is a combination. The way that I look at it, it's a combination of our ego self, which is the human part of the human being, and our being self, which is the spiritual part of the human being. And we need both in order to be human beings, in order to be in these bodies. So our egos are not our enemies. Our egos are just a part of us. And my belief is that the ego works very well for us if it's a servant, and doesn't do so well for us if it becomes a master. And a lot of people who have been abused, abandoned, or neglected have felt like they're not safe in the world, and they're at risk of being killed or harmed or hurt. And so they develop defenses against that. And those defenses we call in psychology ego defenses. And those defenses keep us feeling more in control and safer. And unfortunately, when we have been abused, neglected, or abandoned, or all three, that part of us, the ego part of us, we need to shore up so much that we forget that there's a being part of us. And that's when the ego becomes very, very powerful and takes us over. And then we see all sorts of negative behaviors, negative feelings, a lot of fear, a lot of anxiety, and our lives don't go in the manner that we really wish them to go. So that's why we've been talking about addictions and codependency, because those are offshoots of addiction issues, of ego issues.
Right. And also, since you mentioned codependency, basically codependency, as we have said it before, and for those of new listeners and viewers, we can redefine it as the disease of false self, which is exactly what we're talking about. And many people who have codependency way of life, they don't even notice that they have it.
Well, they don't know because they haven't experienced anything else.
Exactly. And then, but one thing that they experience is profound and sometimes kind of pervasive unhappiness.
Yes, unhappiness. And unfortunately, people who are unhappy often spread that energy around.
Right.
So they make other people unhappy. And unhappiness really is about being to a large extent, has to do with being over-identified with our ego self. Right. And under-identified with our spirit self.
Right. And like you said, we exchange energy together.
We do.
Right. So one behavior, can kind of ignite another behavior. One feeling can do the same with another feeling, right? So it's not that one person wakes up in the morning and decides to be unhappy. So there are circumstances, situations that kind of either pervasively, happens, or situational factors that happens. And then people get affected and get targeted,
Mm-hmm.
by a variety of energies,
Right.
right? And then and we subconsciously respond,
Mm-hmm.
right? Sometimes things happen that they are not in favor, and we don't know that, and sometimes they are in favor and we don't know that.
Mm-hmm.
So someday we wake up, we are happy. Someday we wake up, we are not so happy, and we can't really pinpoint a definite reason as to why,
Right.
right? Sometimes we engage in a behavior that we have no recollection of,
Mm-hmm.
right?
Mm-hmm.
And then, so when it is brought up, this kind of becomes kind of offensive that,
Mm-hmm.
but then again, subconsciously, we do things, and then uh, subconsciously we become a codependent,
Mm-hmm. Right.
right?
Well, nobody wakes up one day and says, "I'm going to be a codependent."
Right.
Nor do people really even think about.
Right.
Most of the time, they're not thinking about what codependency is. People are just living their lives, and um, so the book that one of the books that we're writing, "The Subconscious Runs the Show," is our way of trying to educate people that although you may believe that you make conscious decisions, and you make conscious decisions, but often they're motivated by unconscious beliefs or unconscious ideas
Right.
that we're not in touch with.
And those unconscious beliefs or ideas are um, kind of serve like a blueprint
Mm-hmm.
for our actions.
Right.
They are fundamental aspect of how we talk, how we think, how we believe, how we perceive, how we feel, how we think, and ultimately how we behave.
Exactly.
Right. So to get to know the depth of codependency and understanding what makes us perform as our own false self versus our own true self. First, we need to understand that we left our true self way behind,
Mm-hmm.
sometimes in our history, because we got adapted to that false self, and then subconsciously we develop beliefs and way of life as a form of our protection and survival.
Yeah. So when we're talking about this, and we're talking about it in a very philosophical way, we're discussing what actually it is in terms of ideas. But how does this actually play out? What actually happens in somebody's life? So I can give you an example of a client that I work with, and he grew up in a family where his father was a womanizer, and so his father was not upfront and honest about it. He would sneak around, and so my client, he grew up finding evidence that his father was cheating on his mother, um, and and as a result, he got the message that that's what men do, and that it's okay because after all, I look up to my father, and my father is doing it, and what's wrong with it? So he believed that it was okay, and then when he grew up and he got married, he repeated the same behavior, and so. Uh, that became problematic in his marriage, obviously. And one of the big things in relationships, of course, is trust. We need to trust the other partner. We need to trust not just the behavior of the other partner, but we also need to trust that the other partner cares about our feelings. And so, if in his case, he was living under the belief, well, what she doesn't know doesn't hurt her, and so he would cheat. But that also made him have to lie, because he would have to lie about where he was and how he was spending his time. And after a while, the lying became so ubiquitous throughout the relationship, and she caught him in some lies, And she eventually decided to hire a private detective. And the private detective, of course, discovered that he had other women on the side, not just one, but he had several, and it caused a big hassle because he did love his wife, and he had children, and she threatened to leave, and that actually got him to come into therapy. And during the therapy, he started to talk about, how he learned this, and that how he normalized it. And that's an example of the subconscious running the show. And as he talked about it, he started to realize that he saw that his mother and father weren't very close, and he always thought of them as being close. But then, as we talked, he realized they weren't as close as he had imagined, and then he realized, well, how could they be? Because he was spending time and energy connecting with other women, and it wasn't just a sexual thing, and although sex was a big part of it, but it was also an emotional thing. And so this is an example of the subconscious runs the show. And so uh, and then it can also work in reverse. I've worked with people who saw that their parents were a certain way, and they decided to go the opposite way,
Mm-hmm.
right? I worked with a woman who saw her mother always being at school and working and never attending to the family. And so she vowed that that wasn't going to be her life, and she became not just a stay-at-home mom, but she became like obsessed with her children, and it was too much. It was too much. But it was a reaction to what she saw, and so it wasn't her authentic self either. It was a reaction to something that she saw that she vowed she wouldn't do, and she went too far in the other direction, and that wasn't her true self either. So what we want in therapy is to discover who we really are and what's right for us, and and that takes effort. And one of the biggest problems is that most of us have put our parents on a pedestal, which that's not really a problem when you're little. We need to have our parents on a pedestal. We need to feel like our parents are there and they're going to take good care of us. But when we keep them on a pedestal and we don't see that they're imperfect, and especially if our parent wants to be on that pedestal, then then as if we do go into therapy, we're hesitant to say anything negative about them, because we feel disloyal and we feel like we might be hurting them, even though they're not in the room with us. They don't feel good about saying anything negative about their parents. And so I hear, and I know you hear too, that the line most often said, which is, they did the best they could.
They did the best they could, yes. And subconsciously, we fear the loss of love as well with
Right,
them.
right.
We just got a notice that, our commercial break is approaching, and we would like to invite you to please call us and share your ideas. 951-922-3532. Please join us again right after this commercial break.
See you soon.
Welcome back to our commercial break. This is Heart-to-Heart program at KMET 1490 AM, ABC News Radio. For those of you just tuning in, our discussion for this segment is about codependency, addictions, relationships, and trauma with Dr. Robert Jaffe. Those listening to Heart-to-Heart Live, we are encouraged for you to please call us and ask questions. And our phone number here at the station is 951-922-3532. We also welcome your private calls and private emails. Our informations are at the KMET webpage, and we look forward to for you to join us. And then you can also visit us at our YouTube channel, heart-2-heart.online/YouTube. And please introduce our program to those that you believe they can benefit from. We appreciate your contribution and we welcome you to our program. So, Dr. Jaffe, you were talking about codependency.
Codependency, and what I say about codependency, it's the most underrated addiction. Codependency is an addiction to the other. And what is the other? The other is people, places, and things. So we define ourselves by our relationship to others. And if others are smiling at us, then we feel good. And if others are frowning at us, that we feel bad. And so people might say, well, doesn't everybody feel that way? If somebody's frowning at you, you don't feel good. And my answer is, yes, that's true. But the question is, can you still feel good even in the face of somebody frowning at you? Because yes, it doesn't feel good for the other person to frown, but at the same time, the other person has an impact on you, but doesn't control you. And we have impacts on other people, but we don't control them. So we are still responsible for how we feel at any given moment.
Exactly.
Other people don't make us feel a certain way. And that's very hard for people to understand, because it appears at a very surface level that other people's behaviors causes us to feel things. And of course, if that were true, then we would all have these superpowers, and we would be able to magically make somebody like us or dislike us by the way that we acted. And we would, and so, and of course that isn't true. People may like us or dislike us for reasons that have nothing to do with our behavior, right? So what are some of the characteristics of codependency? One of the characteristics is that people who are codependent are envious, they are critical, they idealize other people, or they idealize themselves. What does idealized mean? It means that I can do no wrong. I'm right in everything that I think, say, or do. And they are perfectionistic, meaning that if you make a mistake, then you are a mistake. The opposite of those is simply accepting of yourself and accepting of other people. That doesn't mean that you like particular qualities. You're entitled to your particular preferences. So being accepting of someone doesn't necessarily mean you like that person, but it means that you don't use your like or dislike to attack the other person. You simply have your own personal preference, and you can, and that's okay. We can like people or not like them. Another aspect of codependency is it's other-oriented. So we're looking at others to decide how we should think, feel, and behave. And also we're overly conforming to other people. That's the opposite of that would be that we're compassionate. We can have compassion for people. Another aspect would be a conditional love. I love you if you will do this for me. I love you if you will have sex with me. I love you if you will cook for me. And if you don't have sex with me and you don't cook for me, then I don't love you.
And there are times that these expectations are not explicitly communicated.
Correct.
Right. Many of our requests and expectations are so pervasively, implicitly are applied,
Mm-hmm.
right? To the point that we are not even recognizing that what kind of expectations we have, what kind of a demands we have, what kind of an outlook we have, what kind of a belief we have, that how those impact the person that we are living with or we are partnered with, right?
Right.
And then those expectations, when they are not apparent, when they are not recognized, but they are becoming red flags in relationships.
Mm-hmm.
Right.
Exactly. Yeah.
So codependency can be also very much silent process.
Yeah. Yeah. Because the truth is, we don't communicate just with words,
Just with words, yeah.
right? What we are is energy. And we now know that everything that appears solid at the subatomic level is actually energy. It's movement. And when we go down to the super subatomic level, when we go into the atom, we discover that there are subatomic particles that aren't solid, but they're actually, they blink in and out of sight, in and out of existence, millions of times per second, giving the illusion that they're solid. So what we actually see in the world is actually a big light show. It doesn't exist at the subatomic level the way we believe it exists. But that's a little philosophical. What we're talking about right now is who is responsible for how you feel and your behavior. And when we're codependent, we don't take that responsibility on. We don't feel like like we are responsible. We feel like someone is making us uh, think, feel, or do something.
Well, I hear that a lot in my practice. Couples come in here and they point finger at each other, that you said that, you made me feel this way, you made me angry. If you wouldn't have said that or done that, I wouldn't have responded the way I did.
Right.
And also I see, couples come in and they say, well, things just don't work out between us anymore. And they cannot really identify something significant as to why they got to that point,
Mm-hmm.
right?
Mm-hmm.
And then, and they end up blaming each other, but they say we love each other, but things are not working. She is not or he is not exactly the one that I want, and they don't realize that how this is playing out,
Mm-hmm.
and they can identify a significant factor because their codependency is been so pervasively embodied in their mind that they don't recognize it. They think what they feel and what they say and what they want, it's so normal.
Right. Right. Yeah. So um, what what we have then is we have people enacting things that are going on inside of them that they don't realize are there because they are subconscious. By definition, subconscious means it's out of awareness.
Right.
We now know that the levels of the brain, at a gross level, there's the conscious mind, which is what we're aware of. There's the subconscious mind, which is something that we're not quite aware of, but if someone says something to us and it reminds us of that, we go, oh yes, that's accurate.
Right.
And then there's the unconscious. And the unconscious is deep scripting that we have, that even if the person says it, we go, no, I don't recognize that, or I don't feel that,
Or I didn't do that.
or I didn't do that, or that, or yeah. And the unconscious is also very, very powerful. So um, I can use an example of this. My mother, may she rest in peace, disliked women. Um, she she disliked women because her mother was very mean to her. So my mother had what we would call a positive feeling or a positive transference to men because she liked her father. Her father was kind to her. She disliked women because her mother was mean to her. And I heard so many stories about her mother. And my mother, just like my sister, and like me. I'm male, my sister was female, and I think that was a big part of it. Also, my sister was different than me because I submerged a lot of my negative feelings and my sister verbalized them. So when my mother was mean to her, my sister would complain, and that got my mother even more angry. And so as we grew up, my mother said, "I want to take you guys out to lunch." And so we're sitting there, and the reason that she wanted to take us out to lunch is it was my sister's birthday. And so we're all sitting there at the lunch table, and my mother says very innocently, I just felt like taking you guys out to lunch, no particular reason. And of course, that was very hurtful to my sister. And
I can only imagine.
yeah, and I said, "Oh my God!" I said, "How can you say that?" I said, "You said you wanted to take us out. It's Lisa's birthday." And my mother looked at me, and I promise you, she had absolutely no awareness that she even said it, let alone that it was hurtful to my sister. Her face was totally blank. She had no awareness. And that was the negative transference that she had used against my sister's whole life. Those type of things that happen that affect who we are or who we believe we are and how we relate to other people in our lives are so, I'm going to say, ubiquitous in society. And the goal of therapy, Sigmund Freud said that the goal of therapy is to make the subconscious conscious, meaning that the things that you're not aware of, you can become aware of, and then you can alter them because now you're aware of them. You can do something differently.
And what you described doesn't just happen between a parent and a child.
Right.
It happens between siblings. It happens between friends, right? There are friends that they actually, they seem to be on the surface best friends, whether they are male, female, or two females, or uh, I've seen that mostly between two females, or not. And then subconsciously, they really, one cannot stand the other one, right? But because of that idealization that you described, they stay together. And then, I've seen it between couples that uh, that they have, deep friendships and all of that. And where in fact, one also, for a variety of subconscious reasons, is not there as a friend, really. It's just there based on subconscious needs, right? And then eventually, I have seen that backfires too, right? And so codependency is not just, you know, uh, just we can't just sum that in a falsehood kind of a behavior, right? It's so deeper than that, and we see that plays out so profoundly at the societal level. We see that at the governmental sectors, right? We see that in so many areas of society, and we don't see codependency per se among younger generation, right? Because it's not fully kind of embodied itself, but we see it more about from age 25 and up, right? About age like 50, age 60, it becomes kind of that's the deepest that we see it. And then depending on, of course, who identifies that, oh, there is something going on that I'm not happy about myself, and they start doing something about it, it can haunt the person throughout their life.
It can, yeah. And another aspect of codependency is that when you're codependent, you're in a state of pretense. You're not authentic.
Right.
And one of the things that you pretend when you're codependent is that you're always strong.
You're always strong. You're
Right,
always,
right.
loving. You always love a person.
Mm-hmm.
You
Mm-hmm.
know.
Right.
Right.
You don't when you're authentic, you allow yourself to be vulnerable, and you can say "ouch" when somebody hurts you. That hurt my feelings. But you don't want to say that if you're dealing with somebody who isn't safe, because if the person isn't safe, that means that they don't care that they hurt your feelings, or worse yet, they want to hurt your feelings.
Yeah.
So so if you say "ouch," that hurt my feelings, that person takes delight in it.
Well, yes. I mean, we say that, and we put this in practice as well, right?
Mm-hmm.
But when that ouching becomes too many times, and then the hurting becomes too many times, you realize that no matter how many times you say "ouch," the other person doesn't
Doesn't change.
identify with it, doesn't change, and makes you wonder how deep those unconscious messages are engraved, and uh, what can be done about them,
Yeah.
or if the person is willing actually to do something about them.
Mm-hmm. So we need to stop now. We're going to take another
Yeah.
break, and we will see you back in a couple of moments.
Looking forward to it.
Bye.
Welcome back from the commercial break. Dr. Mitra and Dr. Robert here at KMET 1490 AM, ABC News Radio, Heart to Heart program. We're talking about codependency with Dr. Robert Jaffe. Our phone number here live is 951-922-3532.
So we're talking a lot about codependency. I'm going to call it the most prolific and the most hidden addiction. It's addiction to the other, meaning that we are out of touch with our authentic true self. Our authentic true self comes out when it feels safe to do so. So it starts in childhood. And if we are lucky enough to have parents who welcome our authentic true self, then they welcome all of our observations, they welcome all of our thoughts and feelings, and and children, they feel things very strongly. They don't have the thinking part of their brain developed. Uh, you know, it actually takes many years to develop fully the thinking part of our brain. We don't really develop that into beginning in our late 20s and 30s. Um, and so that part of ourself that develops that thinking brain is not available to us when we're children. So we take in information through our feelings, our emotions, and and we learn how to talk at a very young age. We learn how to talk usually around or before 2 years old. And so, what do we talk? What do we say? We say the things that we've heard. We start repeating the words that we've heard. And we understand what those words are because we've been hearing them now for the past 2 years, and our brain makes sense out of it. And so that's that. So that's what happens. And so
And if we don't use words, we behave. We put them in action.
Exactly. We express ourselves through our words and behaviors.
Right. So we can tell somebody that, we can reject somebody unconsciously via behavior.
Exactly.
Yeah.
Exactly. So what does this mean then with respect to the authentic true self and the false codependent self? Is that the things that we learn at a feeling level when we're little become truths for us. So, for example, if we're taught by our parents that it isn't okay to hit our sibling, when our sibling upsets us. Our sibling, let's say, takes our toy, and we're taught that it's not okay to hit, um, that then we learn that it's not okay. So I have two grandchildren. They're both 2 years old, a little over two, and they have been, jealous of each other's toys when they take it, even though they both have the same toys. When one has one and the other doesn't see the one within their sight, they want the one the other one has, and then they'll take it, and then the one who got taken from they will hit, and so my daughter and my son-in-law, they have a book, and the book says hands are not for hitting. And so they will repeat that: hands are not for hitting, use your words, and here's what you can say. And they give them examples of what they can say. But let's say, it's not my daughter and my son-in-law. It's another couple, and that couple hasn't learned how to communicate that hands are not for hitting. They may actually take away the toy that the one grabbed from the other, and slap the hand of the one who grabbed it. And so what are they doing? They're demonstrating that hands are for hitting, right? Even though they're trying to teach the child the opposite, but they're demonstrating through their behavior that it's okay to hit at certain times. And so what does this mean about codependency? It means that our authentic true self, um, which has a feeling of, oh, I didn't like it that my sibling took that from me. That part of me goes underground, and instead I act it out through my behavior. And so so if I don't learn anything different, then that behavior will stay with me. And if I grow up and I learn, okay, in society we can't hit, then I will try to denigrate the other person. I'll try to make the other person feel bad with my words. I will hit them with my words. And so that's different than our authentic true self, that would say, I don't like it when you took my toy, and I don't appreciate it, and it's not fair, and I would like it back. I will play with it, and then I'll give it back to you. See? So that's an example of how our inauthentic or codependent self evolves.
Exactly. And so as we can see that we are teaching, how this codependency becomes a societal pervasive issue, is because parents who are codependent, they don't realize that, they don't do anything about it as a result, and they kind of you know pass on that codependent behavior to their children.
Right, right. So my belief is that our authentic true self is what the majority of us are born with. I don't know about everybody, but I think the vast majority of us are born with, and that part is our connection to love and to God. God to me is an energy force of love and creativity. And so our authentic true self then becomes an avenue to express that part of ourselves that is both creative and loving. And when we are expressing ourselves in a way that is creative and loving to others, it accesses that part of the other person that is creative and loving, and that's what we usually get back. So it's very simple, right? If you're walking along on a sidewalk and you smile at somebody, well, the person isn't guaranteed to smile back at you, but the chances are better that they will, because you're giving them that positive energy
Mhm.
through your smile. So our codependent self is, I'm going to say, the opposite of love to me, which is fear. And fear is the part of us that is ego based. That's not to say that the ego is all about fear, but the ego has a great investment in fear, because we need fear in order to keep ourselves physically safe, right? So
Exactly.
so fear motivates us to keep us safe. But in our society, where we're a little more advanced technologically, and we don't have to worry on a day-to-day basis. At least a lot of us, some of us do, but a lot of us don't have to worry on a day-to-day basis that someone is going to walk up and shoot us, or that we're going to not have a meal. Well, a lot of us do have those things. We have the meal and we have the shelter, so we don't have that kind of fear for our egos to engage in. Our egos then expand their preview, and they make it about emotional fear, which is if someone is not nice to us, then our ego comes out and protects us in a way as though we were having our life threatened. So when we're not nice to somebody, or we're mean spirited, or we say ugly things to someone, or we threaten the other person's ego will then come back and engage with us. And they may engage by running away, or they may engage by threatening us back. And that's mostly what arguments are about. They're about one person trying to threaten another person or be unkind to another person, and the other person picking up on that and going, no, I'm not going to let you. And the obvious solution is when you're driving in a car and somebody cuts you off and you give them the finger, and then they speed up and they try to cut you off and they give you the finger back, and that's the ego part of us that's acting as though our life is being threatened, whereas actually our life is being threatened at that point, because we're acting as though it's a life-threatening situation. We create the life-threatening situation rather than what? Rather than somebody cuts us off and we say, oh boy, that was scary, and we don't like it, but we also say, I don't want to create harm, so I'm not going to do anything about it. I'm going to recognize it's scary and I didn't like it, but I'm not going to act it out in a way that makes the other person upset, because then we're in an ego battle.
Right. And, when I actually have a couple like that right now, that they are in such an ego battle with each other, and that, I honestly, I don't know if they're going to survive in this marriage,
Mm-hmm.
And I have told them that, because none of them is willing to take a look at, their communication from a different perspective than their ego-based
Right.
survival mechanism. And
Yeah.
I mean, they rather be right in their, approach than to be able to put the guards down and look at each other and hear each other and see the actual messages that's being broadcasted through their conversations.
Yeah,
Right.
It's as though they're fighting for their life,
Yeah.
and the prize is being right.
Right.
Mm-hmm.
Exactly.
Yeah.
And while I've been working with them for a while, and they have been to other therapists, and the reason they have disconnected the work with their other therapists, because they believe that the therapists didn't understand them and they didn't side with them.
Mm-hmm.
So they're looking for therapists to side with one.
Mm-hmm.
Both of them want me to side with either one of them, right? And you and I know that that's not happening. And so that's a very good example of profound codependency.
Yes.
In relationships.
Yes, it's codependent because each of them are seeing the other as causing them pain, rather than I'm causing myself pain in the way that I'm viewing myself and my partner.
Right.
I'm viewing myself as being victimized. Mm-hmm. I'm viewing my partner as a perpetrator.
Right.
And so the way that I choose to view it is causing me pain.
Right.
The truth of it is that if I could say I'm causing me pain, then I can say, well, I don't have to do what I've been doing.
Right.
It's sort of like, doctor, it hurts when I do this, and the doctor says, don't do this, right? So we keep repeating the same behavior over and over again. And the behavior comes in the form of feelings, thoughts, and actions. And we expect a different result, which in the addictions community, we refer to that as insanity. repeating the same behavior over and over, expecting a different result.
Yes.
And yet they keep doing it because underneath they're feeling as though their life is being threatened. But if you say that to them, you feel as if your life is being threatened, it's too far above where they are. They're not going to understand that that's how they're acting.
Exactly.
So you have to talk to them then about the fact that they are have attached themselves to this particular way of thinking, and that this isn't the only way to deal with it. And if it's not the only way to deal with it, another way to deal with it would be to say, if you're saying things that are unkind to me, that must mean that you're in pain,
Right.
because you're not seeing the loving part of me.
Right. Right.
Yeah.
Yeah. And then so but that requires for a person to be able to feel safe that they can look at their situation differently,
Mm-hmm.
and that takes longer therapy, right?
Yes.
Which makes some people who are in that stage of mind or a state of mind, they don't have patience
Mm-hmm.
to understand what's going on.
Mm-hmm.
So it's a very delicate situation, and it takes lots of empathy from the side of therapists
Yes.
to invite them to look at themselves empathically to begin with, and not be so mad at themselves.
Yes. And so codependency is pain based.
Right.
It has to do with pain that we're in, that we try to use another person in order to heal. If that person will reflect us in the way that we want to be seen, then we feel good and we think that that's healing. We don't recognize that we're still depending on the other person to look at us a certain way. And once the person doesn't see that about us, my goodness.
Something's happening.
Something's happening. And so once the person doesn't see that about us, that they're reflecting something negative about us, we feel as though we're being injured.
Right.
Yes.
As we are being injured by this sound, and we
Well,
apologize.
we're not being injured, but we're being disturbed. So,
so we just got a signal that our program is over.
Okay.
It's about to be end.
Okay.
So I thank you for the information and the insight, and I'd like to invite everyone to please join us next Thursday at 3 p.m. for another episode of Sexual Health, and then Friday for another episode of Codependency, Relationship, Addictions, and Trauma. And until then, don't forget that all you need is love.
Love, love, love.
Have a wonderful Friday.
Okay. Bye-bye.
Bye-bye.